Lady Dr. Jill Biden testing positive today for a rebound case of COVID-19. Here to answer your questions is Dr. Daniel Kritzkes, Chief of Infectious Diseases at the Brigham. Dr. Kritzkes, thanks for being here.
Nice to see you, Erica and Ben.
All right, Dr. Kritzkes, here's what we know from the White House. On August 15th, Mrs. Biden got her first positive test for COVID. Dr. Biden. She develops cold-like symptoms before starting a cycle of the antiviral drug Paxlovid. Dr. Biden then tested negative twice before testing positive again today. Now, we know these rebound cases can happen. In fact, the president experienced his own rebound case of COVID last month. But what do you think this is a sign of regarding Paxlovid? Is it less effective for folks who maybe aren't on the bubble of whether or not they're high risk? Should they even deal with Paxlovid if they are going to get a rebound case? Because, of course, it means another 5 days of isolation and quarantine.
Yeah, I don't think this has anything to do with the Paxlovid per se. A colleague of mine, Dr. John Lee, has data from people who received no treatment at all showing that rebound is common, sometimes with symptoms and sometimes without. We don't know whether she had a PCR test or an antigen test, so it could be that she just had a very low-level positive test, and I don't think this says anything about the efficacy of Paxlovid, which I think continues to be very effective treatment.
Okay, so President Biden is a close contact. The White House says he will mask indoors for the next 10 days per CDC guidelines. Since he just had COVID, though, and it was likely that same BA.5 subvariant, is it truly necessary for him to take those types of precautions?
Well, that's a good question. He is probably pretty well protected, but he is, after all, the president, and he comes in contact with many people. And so I think out of an abundance of caution, they're just being as careful as they can be.
All right, Dr. Kritzkes, let's talk about those new booster shots coming this fall. Both Pfizer and Moderna have submitted applications to the FDA. It's possible we could have these shots available to anybody 12 and older as early as next month. Why do health officials think we need these updated booster shots?
Well, we know that immunity wanes over time, and for many people, if they got boosted at all, it may have been as long as 6 or 9 months ago. And we know that the strains have changed. We're now dealing with BA.4 and 5, as you just mentioned, and the original booster doesn't provide as much antibody neutralization against these strains. So that's why people are now recommending this combination booster shot in the fall.
Okay, well, to another vaccine, one we know well, the flu shot, right? Some local pharmacies, they're already sending out reminders. So what are you telling your patients about scheduling the flu shot?
Well, it's important to get the flu vaccine, but I think it's a little early to do so. I would think that October is a good time to get vaccinated.
And Dr. Kritzkes, do you see, speaking of the flu vaccine, do you see a scenario moving forward after this fall where every fall, maybe September, October, there's a new booster for COVID and then, of course, the flu shot, and you would get both at the same time once a year? Does that make the most sense from a scheduling perspective?
I think that's very likely. I know that some groups are working on a combination influenza SARS-CoV-2 vaccine, so we could very well see that down the road.
All right. Dr. Daniel Kritzkes at the Brigham. Dr. Kritzkes, good to see you.
Same here. Yeah.